Hello, today we are going to talk with Dr. Frank Michalski. He is a chiropractor in New York and Buffalo, New York, and he is an expert with CBD and an expert in his industry. So welcome today.
Thank you for having me, Stacey. Glad to be here.
Absolutely. He's also been offering CBD BioCare products for over a year now. So he truly is an expert, not only with CBD, but also with CBD BioCare. So today we're going to focus on pain because so many of us understand what back pain specifically is all about. It's estimated that 31 million Americans suffer on a daily basis with back pain. So Dr. Frank, I know this is your industry and a lot of people end up at a chiropractor because they are just at their wits' end and can't deal with the pain anymore. So how much of a part of your practice is treating people with back pain?
So what I would say is for our practice specifically, I would say probably about 75 to 80% of the patients that we see are coming in with either neck pain or low back pain. And I'm going to read off some other statistics for our listeners and our viewers to think about, because one of the things that you may hear is there's so many CBD products on the market, there's so many things, but when you really understand the amount of people who are in pain, you quickly realize, wow, we have not reached out to all these people yet. So listen to some of these other statistics to go off of what you were saying. Chronic pain lasts more than 3 months, okay? Most people with back pain, it tends to be chronic, and we have 3 million cases of this a year. Back pain, the cost to the US economy is estimated to be between 80 and $240 billion. When you think about the time missed from work, when you think about the time that it costs the employer, when you think about the lawsuits involved in some of these workers' comp cases or motor vehicle accidents, that's how we get such an astronomical number of 240 billion. Now, another point I really like to emphasize is, because sometimes we hear things like CBD oil is expensive, the creams are expensive. The average back pain patient is spending $2,580 more a year than your other individual when it comes to their healthcare cost, specifically trying to manage that back pain. 80% of back pain is in fact chronic, and then it is the #1 cause of workers' compensation disability. So when we talk about back pain, and when I say probably 75 to 80% of the people in our practice consist of neck or low back pain, when you hear those numbers, it kind of makes sense. It's like, wow, those are some huge numbers. This is catching up to diabetes, cancer, heart disease. Back pain is easily, if not in the top 5, the top 10 reasons for disability, illness. So it is a big deal.
I also read on the Chiropractor Association website that it is the #1 leading cause for people having disability. So, talk about work and being out of work. So it's very obvious that this is a severe problem. And, one of the things that I think people get really discouraged is because a lot of times once you have back pain, especially if it's chronic, you continue to have back pain. So let's talk about some of the solutions, because that's what we're all about, especially when we talk about holistic care like chiropractic care and then adding CBD. So let's understand more about the types of back pain that is present, especially in your practice, which represents the population. You mentioned chronic pain. What other type of pain is there?
Yeah, we can dive into that. Let me start by talking about the importance of a proper diagnosis. And I think any of the reps who are talking to someone, myself, we always want to make sure that we have that proper diagnosis. So what is the cause of the back pain? Is it arthritis? Is it a disc herniation pressing on a nerve? Or is it something else? Other things that we have to consider clinically on our end. Is this person presenting with MS? Are they presenting with neck pain that's maybe related to symptoms of a stroke? Are they coming into our offices with low back pain that's maybe related to an aneurysm? These are more serious examples, but they're things that we have to take into consideration. We see a lot of things in Buffalo, New York with autoimmune disease related pain. So rheumatoid arthritis that's leading to low back pain, or Lyme disease is quite quite the disease here in Buffalo. And that's another thing we often see. So when a patient comes in, or when you're talking to someone, understanding what their diagnosis is and why they have back pain is a really important starting point. So once we get that out of the way, let's look at our average patient. And this is mostly what we see in our offices. This is that patient, which is 80% of most low back pain cases or neck pain cases, that has chronic pain due to arthritis, okay? Now we see two types of individuals. The first type may have an acute pain where it's just a sprain strain style injury, right? They were shoveling, they tweaked a muscle in their back, they didn't fracture anything, they didn't get a disc herniation, they just strained their muscle. We see this type of patient all the time, and this is the patient where I'm always recommending early on, especially in an injury like that. I think our roll-on cream works fantastic with the menthol in it, that cooling effect. That's great for sending signals to the brain, just saying, hey, there's a cooling effect going on. It's helping to alleviate some of that pain. Long-term with that patient, I'm always very quick to reach for the topical cream, specifically the 500 milligram cream. I'll be honest, in our offices, we really only use the 500 milligram strength, the 3.8 ounce jar. We just find that the pain relief is so much longer from that. And I really feel that the roll-on and the pain cream are excellent for that acute sprain strain injury, maybe that chronic whiplash injury, if someone was in a car accident or they took a slip and their head went forwards and backwards. So that would be the first thing, that acute sprain strain injury. Now, the other type of pain, and this is more what I would say a lot of us are very familiar with, or if you're not familiar with it, chances are you've suffered from it at one point or another in your life. 1 in 4 adults will suffer from this type of pain. And this is called neuropathic pain. So this is the patient that comes in and they say they have sciatica. So they have numbness and tingling going down their leg. A lot of times when we're talking about the spine, that's due to a disc herniation or a disc bulge. Now, treatment for those, chiropractic care, physical therapy, you can also look to surgery, fusions, things like that, which we try and avoid those extreme cases. We try and avoid those more aggressive surgeries. We want conservative treatments. We see that all the time as well. I find that using the topical cream locally on the back to help with that muscle spasm goes a long way. But when I see those patients with neuropathic pain, that's really where we're starting to reach more for an oral CBD oil because of the effects that taking CBD orally will have. It's important for people to understand, historically, neuropathic pain from the low back was treated with opioids. And that obviously fell apart. People developed addictions. The studies were showing, hey, these things aren't working as great as we once thought they did. When you look at how CBD oil affects neuropathic pain, it really works in 3 ways, and I'll just briefly touch on them. When you injure your spine, and I'm going to show this to people briefly real quick, a quick anatomy lesson. This is what your spine looks like from behind. These yellow things are nerves, okay? Right here, we have this red spot. That's a disc herniation. That's a disc bulge right in there, okay? When that disc bulges out and puts pressure on the nerve, that creates nerve pain or sciatica. How CBD oil works is this nerve is sending a message to your brain saying that you have pain. CBD oil, one of the ways it works is it reduces the amount of pain messengers being sent to your brain. And that's actually kind of comparable to how opioids work, except without all the negative side effects that you get with opioids. That's why it's not something we're talking about today. But when you read about CBD oil, you're seeing a lot of people use it for opioid addiction and tapering off of opioids because of that similar mechanism of action. So 1, it reduces the pain signals going to the brain. Secondly, it reduces the inflammatory chemicals involved in inflammation. That will also lead to pain relief. Lastly, it helps to balance out your endocannabinoid levels, which are closely related to the level of intensity of pain that you are feeling. If you've ever met a patient who's had chronic pain and maybe they bump their hand and they're like, oh my gosh, that hurts so much, that killed. And it's like, wow, that seems like an exaggerated response. Why are they in so much pain from such a little bump on their hand or a little bump on their back? It's because these people's pain signals are in overdrive, and CBD oil orally taken helps to calm that down. Um, I'll wrap that up with saying too, I don't want people to mistake the power of the topical ones. We always give patients, especially our chronic pain patients, both the topical and the oil as well. The reason being is, whether or not you know it, your skin has an abundance of CB2 receptors. Your skin is the organ that actually has the most CB2 receptors on it. The CBD oil binds to these receptors and then will locally decrease inflammation in that area, right? So that person who sprains their elbow or rolls their ankle, even the chronic back pain patient, you could see the advantage to using a topical. And that's really the bulk of what we see here.
So it really sounds like you're talking about um, for whether it's lower back pain or the neck pain you indicated, you're using the cream or the gel roll-on topically, but then you're also taking the oral drop so that you're working internally, and they're both really doing some of the same things. They're working synergistically together.
Yeah, and I find that's really where we get the best results. A common question I'll get, so we have a lot of patients come in, and this is to that point earlier that you made, understanding the diagnosis. We have a lot of patients who come in and they're saying, I have sciatica from a disc herniation. And they're saying, listen, I really want to take the oil. I'm hoping it's going to help my low back pain. When we see a specific injury like that, I think the oil can be a huge benefit, but I'm very quick to recommend the topical, because I know most, in let's say 80% of cases, they're going to report immediate relief in the low back. The sciatic and the nerve pain, depending on the severity of it, depending on the nature of the disc herniation, I do tell patients the oral oil, it tends to be a little more hit or miss in those cases. I don't like to say, look, this is going to cure your sciatica, right? We can't say that. We don't want to say that. And I want the patient to have a realistic expectation of what they'll see. So I say, listen, in this specific defined incident, so this person, they don't have fibromyalgia, they don't have rheumatoid arthritis, because for those patients, the oil works fantastic. That's a no-brainer. In most cases, I'm saying, look, I really expect a huge improvement with this. For your specific injury, a one-time incident of back pain, they're asking me about sciatica. I'm saying, listen, this can absolutely help to numb that neuropathic pain taking it orally, but it's probably not going to fully resolve the sciatica. Not saying that doesn't happen. Just you don't want to over promise things to people and then have them underwhelmed. It's always safer to play it on the cautionary side of your recommendations. So yes, the cream is in my opinion a must. I mean, I don't think there's one person that we interact with throughout the day where we're not recommending the cream. The oil we're saving for those nerve pain patients, we're saving for those fibromyalgia patients, the MS patients, the patients who really are dealing with chronic pain due to some autoimmune disease. And that's really where I'm expecting to see more dramatic results when it comes to pain relief from the oral oil.
So, when are your patients experiencing relief when they use the oil? Is it immediate for most, or do you find that most of them realize over time an improvement?
Yeah, of course. So topically, I would say it's immediate. Now, orally, and I really think this comes down to messing with that dosage. So depending on how you take your approach to dosage, there's obviously different guidelines out there. We usually start people at 10 to 20 milligrams per dose, and we carry that out between 1 and 3 times a day. So that's anywhere from 10 milligrams a day up to 60 milligrams a day, taken in morning, afternoon, and evening. Now, we take that approach and we say, listen, your pain patient, let me be clear on this, especially if they're chronic pain, they're probably dealing with anxiety, they're probably dealing with insomnia, they're probably dealing with depression, and unfortunately, due to the opioid crisis, a lot of them are dealing with addiction too now. So we like to explain to people, when you take this oil, you might see relief from your depression or some relief from the anxiety at 20 milligrams. That's great. That means it's working. But we might need to bump you up to 60 or 100 milligrams depending on the type of pain that this person's having. And it really varies. So once we find that correct dosage, it seems to work pretty quickly. I usually say within a week. That's my general rule of thumb. Now, we do have people where it may take us a month and a half to get them to that correct dosage. So it can take longer, but I don't necessarily think it's because the product takes that much longer to work. It's more so because finding that correct dosage sometimes can be a little bit of a back and forth. And just for a general guideline for people too, when you have nerve pain, neuropathic pain, it takes a long time for a nerve to heal. So I tell people it wouldn't be unsafe to say, especially if this is the only source of care that they're really seeking, CBD oil, to say, hey, look, hang in there for a solid 8 weeks, 3 months even. That's not unreasonable to say that by any means.
So what would you tell someone who doesn't have the privilege of speaking to you or another expert in terms of how much oil to take? What's a good guideline that you recommend?
So for us, and now I have had a few experiences that were different. Generally speaking, we recommend starting at 20 milligrams a day, 10 in the morning, 10 in the evening, and then we'll work all the way up to 100 milligrams a day. And of course, let's say we hit 100 milligrams a day and they have the 3,500 or the 1,000 milligram concentration. We'll simply, next time that patient or that client buys something, we'll recommend the 3,500 just to get that obviously stronger dosage. But yeah, I would say start between 10 and 20 milligrams a day and work your way up. And the big thing to keep in mind too when you're talking to these people is it's very rare I see this, but it's important to remember CBD oil can have a biphasic effect. So at too low of a dose, it's not going to work. At too high of a dose, you may get some unwanted side effects. In the only case where I've ever really seen this is with depression and anxiety. 90% of the time it helps people, depending on the medications they're on, depending on their life circumstances. I've had a case or two where they've said, hey, my pain's feeling much better, but my anxiety seems worse for some reason. So then we know, okay, this is great, it's working, but we now need to tweak that dosage to try and hopefully address the anxiety and the pain. So that's why we recommend going in such a slow manner, because usually someone with chronic pain is going to have insomnia, they're going to have depression, they're going to have anxiety, loss of work, whatever it may be. So that's why we recommend going up in that 10 milligrams to 20 milligrams a day. Do that for the first 3 days. If you don't notice a result, increase that 40 milligrams to 80 milligrams a day. If you don't notice a result, let's take it all the way up to 100 milligrams a day in 3 separate dosages and go from there. Once they're not seeing a result around 100 to 150 milligrams a day, I'm usually starting to question, okay, what else is going on here? Is this the correct diagnosis? Is this patient just simply not responding to CBD? That's where I really start to wonder. Once you're above that 100 to 200 milligrams a day.
I think that's really great that you mentioned the fact that sometimes you're taking too much, because I think it's our tendency to say, oh, well, this isn't working, so let's take more. But oftentimes we've seen the opposite effect, especially for people with sleep, where they're taking too much and all they have to do is drop that serving size down and they find their perfect balance. So I think that's the message we want people to hear, is that there is some experimenting. Some people get it right the first time, and we often tell people, if let's say you're taking the 1,000 milligram and you took a half of a dropper and that worked for you, do that for a few days and then try even dropping it down just a little bit to see if you can get the same benefit, because then you're using less and it's lasting longer, and then it's just a win-win.
Completely. And I think that's so important too, from just a honesty standpoint. It just makes you look honest. You're not just having this person burn through product. You're telling them, hey, look, we might be able to save you money, whether they had to take more, and you're saying we'll get you a stronger concentration, which is more cost effective. You guys have the prices laid out on your website. Or telling them exactly that. Listen, try taking less. That's great. It worked at 40 milligrams a day. Let's maybe try 30 milligrams a day or 20. Let's see if that works. worst case scenario, you just go back up to that dosage that you found. Yeah.
Absolutely. So, how many of your patients are using a CBD BioCare product? Or would you say that most of them you incorporate a CBD product into their treatment plan?
It is. It's pretty much everyone. I mean, in my point of view, especially now, we're starting to see more literature on this, talking about using CBD oil preventatively for certain diseases. Right now, the evidence isn't fully out there yet, so we have to be cautious in what we say. But they are starting to study, hey, if there's a history of cardiac disease, if there's a history of breast cancer, should this person be taking CBD oil just daily in a low maintenance dose to potentially prevent these things in the future? So in my mind, I can pretty easily justify it for almost not everyone, right? Of course, if they wind up having an allergy or a bad reaction, then you pump the brakes. But no, I would say pretty much every person that comes through my office, and mind you, every person coming through my office is in pain. I'm recommending CBD oil. And even if, say we recommend it for pain, maybe it doesn't do exactly what we wanted there, but they say, hey, the anxiety is less and my sleep is better. Well, that's great, because the more you sleep, the more recovery you're going to have, and you need your muscles and your joints and your tendons to heal. And that process occurs during the evening. So for me, that's a win-win. Even if we don't get that pain relief, I'm always asking about what other things do they have going on that may be positively affected. So for me, we're recommending it to everyone. Honestly, this isn't, at least I'd say 90% of our practice uses the cream. I mean, we go through a lot of the cream. And I think the people who don't use the oral oil, I think it's still, they're just waiting to see it become something more mainstream. With our younger clients, I'd say under 50, there's not much hesitation. Some of our older population who may really be benefiting the most, they're just not fully on board yet. So yeah, but a majority of people were mentioning it too. 90% of the people I interact with on a day, we're having a discussion about CBD oil. When you look at those numbers, those statistics, 1 in 4 is going to have pain. 80% of adults, 80% of it is chronic. How could you not have that discussion with people? Almost, I feel like it'd be a disservice not to mention it to them. People will spend their money on so many things. Right? We'll go buy a cheeseburger for $10 and a drink, a glass of wine for $15. And I think it's a disservice not to mention something that could help them like that. So yeah.
Well, that's great. It's, CBD is a win. We see it every single day in terms of pain and so many other ailments that it's assisting people in the healing process. So thank you for your information on pain, specifically in the back, and how it is helping your patients feel better. So thank
Yeah,
you
of
so much for
course.
that.
Of course. Of course. Anytime. More than happy to share it with you guys.